All right, welcome everyone into the Bachelor of Health Science course orientation session for 2021. My name is Hayder Al-Aubaidy and I'm the course coordinator. Just before we start, and this is just to let you know that this course, this session will be monitored, the first part, the presentation part, so that we make it available for the students who won't be able to or who couldn't attend this session. Okay. So in the following slides in this session, you will see or find specific information about the course details, including details about the year one as well as of the majors. And also we'll go quickly through some of the strategies that are available at Trobe and will be able or helpful for you to succeed in your study. And the last bit of the presentation, you will have the opportunity to ask some questions, meet with them, course advisors, and discuss any questions that you may have about their majors. So at the end of the presentation, we will have multiple breakout rooms, each one for a specific major, and you will be able to move freely between these rooms and meet with the relevant course advisors. All right, so Bachelor of Health Sciences is actually a college-owned course, and it is managed by 3 schools within the College of Science, Health and Engineering. This includes the Schools of Life Sciences, School of Psychology and Public Health. Both of these 2 schools are primarily based in Bandura campus, as well as Trobe Rural Health School, which is based at Bendigo campus. So whether, depending on which major and which campus you are based, you'll be doing specific parts of the course. This is one of the largest courses in the university. We've got over 1,000 students currently enrolled in this course. Students are able either to join the course at year 1 and exit or whether they are able to or willing to continue doing all the course in one of these 5 majors, or some of them may exit with a diploma of health. A lot of students are willing to continue throughout this course and graduate with a Bachelor of Health Sciences, and then depending on what they wish to do next, they may either go into a postgraduate study or purchase a specific careers that would be covered for specific majors shortly. But this is just an idea to show you that there are multiple career opportunities available for our graduates. All the information about the Bachelor of Health Science courses is available here at the university handbook. So if you Google Trobe University Handbook for 2021, you will get the links. Just type Bachelor of Health Sciences and we'll provide you with this link. You can find information about the course admission criteria, the contact details of the course coordinator and course advisors, as well as the course structures and the majors and minors that it's consisting of. Obviously, you can do this course with either a single major or a double major. So if you do it with a single major, you'll have sets of electives, more electives that you can do that might be relevant to your next study. All right, so all the students in Bachelor of Health Science, irrelevance of the major they wish to choose, they will need to finish the core first year subjects. And Dr. Amy Larson is the course advisor for the first year. This is her contact details. If you've got any question related to your study in the first year, please feel free to email her and ask her your question. Amy, are you here today?
I am indeed. Hi, everybody.
Thanks, Amy.
Some faces. It's nice to have people's cameras on. Hayder, did you want me to go through some of the information for the core first year? Yep.
Yes, please. So I'll move to the next slide.
Sure. Okay, guys. So as Hayder said, my information is there. You're more than welcome to send me an email if you have any questions about first year or any questions about moving forward into transfers. So as you would be aware, as per your course structure, all of the health sciences degree students complete the same set of course subjects in first year. So you have 3 course subjects in first semester and an elective, and 3 course subjects in your second semester and an elective of your choice. And you're enrolled in subjects with peers across all of your health science subjects. So some of you may have seen me already, as I'm also the subject coordinator for HBA. And as part of those core units, you will be engaging with students from other courses. And this is also assists in a course transfer process. So if you are looking at transferring into another course, a majority of those course subjects are quite similar across those courses. So within that core first year, you do some basic human bioscience. So in HBA, you'll study physiology. In HBB, anatomy. You'll look at factors affecting health. So again, this is your structure of your core first year. So you can see we're in about to commence semester 1. We're not there yet. HBA is human physiology. You'll have introduction to professional practice. So that's foundational concepts, looking at professional practice in your discipline. Individual determinants of health. So foundation of knowledge for working in a health setting. And then you also have an elective. So for those students who haven't chosen an elective, please make sure you do so. And if you need any information around looking at searching for an elective, you're more than welcome to email me. Second semester, you'll then move into Human Biosciences B, which is your human anatomy subject. So it is independent to HBA. One is physiology, one is anatomy. You'll then look at research and evidence in practice. So again, research-based practice, a little bit of statistics, and also based around healthcare. And then social determinants of health, which is a lead on from individual determinants of health. So looking at ways of health, illness, social being, so social aspects of that, again, bringing in that sort of health component. And then you have a first year elective, again, of your choice, as long as it's a 15 credit point subject. So that is the structure of your first year. And as I said, I am available via email. So if you do need to ask me any questions, please reach out. And if I can't give you the answer, I'll be able to guide you and assist you into getting the answer that you need.
Thanks very much, Amy.
My pleasure.
Moving to our first major, which is the health and medical science major, and Dr. Carolyn Taylor is the course advisors for this major. These are her contact details. Feel free to contact her if you've got any question relevant to this major. Carolyn, are you able please to provide an update for this major?
Sure can. Hi everyone, welcome to La Trobe. Now for those of you who've selected the Health and Medical Sciences major already, you probably won't have much to do with me until second year. So if you are interested in this major, we're really going to cover 2 main things. So how the human body works, both at a structural level as well as a functional level. And we also like to think that we at least give you a bit of an idea about what it means to be a scientist. So I know not all of you want to go and do science, but it gives you, or will help you find tools to do research, know where to go and look for information, how you can come up with a plan to solve a question, that kind of thing. So scientist is a very broad term, and the skills are very transferable between different disciplines. So please don't feel freaked out by that statement. It's not meant to be committing you all to a career as a scientist forevermore. Most of the information that I have in this slide was the information that I talked about in the Course Essentials 124 thing that you've probably already seen, but we'll go over it again just in case you didn't manage to see it. Hey, excellent. Thanks, Hayder. So the major will start in second year, and it will really build on your foundational knowledge from HBA and HBB. You can't really progress into the major unless you've passed both of those subjects. So the major is set up so there are 4 core subjects in each of the second year and the third year. Second year, we build on physiology and anatomy. So we look more in detail at the physiological systems that we've introduced you to in HBA, and the same with anatomy. So you do in second year 1 physiology and 1 anatomy subject in each of the 2 semesters. You can do 2 electives in each semester, or you have the option of taking on a double major if you want to. Moving on into third year, we start to look at slightly more applied situations. So rather than doing straight physiology, we will start to look at what happens when physiology goes wrong. So we will look at pathology, so how diseases occur, and we'll also look at pharmacology, so how the drugs work to solve some of these pathological problems. And you will also do anatomy in semester 1. And again, you have the choice of 2 electives in each semester. Now, some students have very specific ideas of what electives they want to do. Others will choose completely random subjects. Remember, an elective is all about your choice. It can help you move forward in your career path, but they don't necessarily have to. Is that my last slide, Hayder, or do I have an? Oh, we do. I do. So don't for a minute think that by doing the health and medical sciences major, you're locked into a career in science. You're very much not. You will get a lot of generic skills which relate to science and medical research. You have the option of going into future study. So quite a few students will stay and do honours, which I know seems a long way away for a lot of you, but it doesn't hurt to have this information. Other students go into allied health disciplines. So this is probably the most common pathway into allied health disciplines, specifically physio and OT and speech. Otherwise, you can do anything. We've had students go into law, quite a few students go into teaching. So don't feel that you're locking yourself into science. You just maybe need to be conscious of the fact that you may need to meet other prereqs if you want to go into graduate entry courses. But don't stress so much about that until at least you start the second year of your degree. But if you do have questions relating to pathways, Hayder and I and Amy to a certain extent are happy to answer questions if it relates to first year.
Thank you, Caroline.
And I'm sure there'll be lots of questions in the breakout rooms in a few minutes' time.
Yeah, certainly. Thanks. Moving to the next two majors, which are public health and health promotion majors, and these are coordinated by Associate Professor Peter Higgs as well as Dr. Sabrina Gupta. So both of them are from the public health department, who they are also leading these two majors. Peter, are you able please to go through?
Sure, thanks. And I've just chucked in the chat my email address for people in case they want to know a bit more about it. Welcome, as Caroline has said, welcome to La Trobe. I was saying beforehand that it has a really different feel in this online space. Normally when we do this, it's a very exciting kind of place. There's a lot of smiling students, all dosed up with coffee and trying to get their heads around what are we actually doing here and stuff. But hopefully at some stage we'll be able to get and meet you all on campus very soon. I'm really excited about having the opportunity to teach into the public health and health promotion majors. As Caroline's kind of outlined though, and Amy, sorry, that they start pretty much in second year. So we know now with the pandemic that there's a lot of interest in public health and public health responses to how we manage that. And here on this slide, you get a bit of a sense as to the kind of things that health promotion and public health do if you're interested in that sort of area. We're really interested in diseases, but we're really much more interested in the way in which communities respond to that and how we can be part of those community responses. Thanks, Hayder. Perhaps surprisingly, seeing tattooing, you don't necessarily think of that as a public health issue, but it was really interesting a number of years ago when tattoo parlours were completely unregulated spaces. There was a student of La Trobe's who was doing a public health major who was involved in helping to design the way in which regulations need to be designed, developed and promoted amongst that industry. So now, especially in Western countries, tattoo parlours are one of the most regulated kind of spaces. So again, think broadly, think laterally about the sorts of areas that you might want to get involved in or the interests that you might want to take forward. Thanks, Hayder. I guess what we're really about is trying to give you a sense of developing skills and knowledge. So we try and make the health promotion and public health majors as hands-on and as applied as possible. It's not just about learning the concepts. So in the subjects that you take going forward, and again, thinking laterally about the sorts of electives you might want to choose, we are trying to give you a sense of the sorts of skills that are required once we start out into the workplace. And I know many of you are already concerned and interested in about the sorts of jobs and spaces that you might want to work in. It's early days. the sorts of things that you're interested in first year aren't necessarily going to be the same ones that you're interested in third year. So really just try and keep as open mind as possible. Talk to your peer mentors. I see there's a number of smiling faces here on the space today as well. Talk to other students who are doing stuff. That's how you'll kind of learn as much as possible. There'll be lots of opportunities to engage with that in when you're on campus and doing stuff. Thanks, Hayder. We also have a focus, as I said, on trying to integrate people into workplaces. So we do have a placement subject in final year, but there are other opportunities to take on placements as either electives or as other things, either in second and third year. Historically, there've been opportunities to travel overseas. That's not likely going to happen in the next foreseeable future, but maybe by the time you guys get to third year, overseas placements will be back on again. We do provide quite a lot of support for those, but we also really encourage and facilitate student initiative in this sort of space. So if you're interested in doing volunteer work, those sorts of things, we can certainly give you some advice about the sorts of agencies or places where you can end up, and making the most of those opportunities is really important as well. Thanks, Hayder. This is just a bit of a snapshot of the range of different organisations that students of ours who've studied public health and health promotion have ended up. It's a really diverse kind of workplace. Yeah, again, don't limit yourself by the sorts of things that you think about necessarily right now. There's plenty of opportunities to be doing stuff both here in Melbourne, but also across the regions in Victoria and other parts of Australia as well. Thanks, Hayder.
Thank you, Peter. So moving next to the rehabilitation counseling, as well as health, well-being, and performance majors. And these are coordinated by Dr. Paul O'Halloran, Dr. Scott Ruddock, as well as Dr. Maria Arini Angolas. So today, I believe that both Paul and Scott are here to provide some highlights for their majors. Mike's to you guys.
That's correct. Thanks, Hayder. Would you mind going to the next slide, please? Okay, so we're really excited to talk to you about both rehabilitation counselling and health, wellbeing and performance. And part of the reason why I got into this area, my original training was in psychology, but part of the reason why I became a rehab counsellor and things like that is the emphasis on helping people achieve their full potential. I think that's incredibly exciting and incredibly satisfying. So as a rehab counsellor, the focus is on the whole person and provides life-changing support, particularly for people who have a physical injury, or it might even be a psychological injury. It might be depression, anxiety, and things like that. But also in health, wellbeing, and performance, there's a focus either on general wellbeing, if that interests you. So we might be talking about, developing wellbeing in the workplace or the broader community. Or if you happen to be interested in sport, you can focus on that. So there's a real variability of the areas you can go into in that health, wellbeing, and performance one. And that's where you're helping athletes achieve optimal mental health, wellbeing, and performance. Thanks, Hayder. So one of the really exciting things about both of these areas is the employment prospects. They're absolutely outstanding. And I think that's one of the really critical things these days when you're thinking about courses and where am I going to go, what's going to happen at the end? And am I going to be in a really good position to get a good job and things like that? So the career prospects, as I said, are absolutely outstanding. So these are just some searches I did just a week ago. You'll see on seek.com, there were 462 rehabilitation counsellor positions. And I do this search throughout the year. And even in COVID and things like that, at the height of COVID, there were still 300 to 500 positions, depending on what week you looked at. According to JORA, there was over 1,800 positions. In terms of health, wellbeing and performance, once again, outstanding. There's on SEEK, there was 3,946 health and or sports specific wellbeing positions. And if you go a bit broader like you do on SEEK and just go wellbeing, there's over 20,000 positions available. Not every single one of those is going to be relevant or something that would interest you, but literally thousands of positions. And the exciting thing is not only are they fantastic right now, but there's very, very strong predictions that it's only going to get better. Thanks, Hayder. So these are just some of the areas where our graduates have been employed, things like TAC, IPAR, people who've been interested in mental health, gone to Mind, NABINET, WorkSafe, AIS, Sport Australia, and even the Australian Defence Force. Thanks, Hayder. And there's a wide range of career options. I think that's one of the things that's really nice about rehab counselling as well. So one of the things I noticed that wasn't here, and that should be a rehabilitation consultant. You can be a case manager, a claims manager, a vocational advisor. You can specialise in mental health or injury management, health and wellbeing advisor, staff wellbeing and injury management, rehabilitation counselling, of course. Can we go to the next slide, please, Hayder? And these are just some of the organisations where people have got jobs. And I mentioned most of these before, but, you know, even things like you can be employee assistant program provider, community mental health services, and as I was saying before, sport or even private practice. Thanks, Hayder. The health, wellbeing and performance, once again, a wide variety of job titles here, and it all depends on whether you want to focus on more general wellbeing or sport. And if you wanted to focus on more general wellbeing, there's health and wellbeing coordinator consultant, wellbeing and inclusion advisor. There's so much area in this space. And as you can imagine, with COVID and the effect that COVID's had on people's mental health and wellbeing, these positions are just so prevalent at the moment. And even in sport, there's, you know, specific things like player development manager, player wellbeing and development manager, etc. So many different things in all of these organisations that I've mentioned on the right-hand side, whether that be schools, private industry, corporations, Matchworks, Australian Institute of Sport, or national sporting organisations. So one of the really exciting things about these majors is the type of skills that you can walk away with. So there's a heavy emphasis on skill development. So one of the things we have an emphasis on is positive psychology. So you all might have heard about that term in relation to wellbeing and things like that. So what we're talking about here is promoting people's wellbeing. We're talking about things like mindfulness, gratitude, strengths-based approaches and all those kinds of things. Sport and exercise psychology, really relevant even if you don't love sport. It's all about developing things that help us perform. It's all about developing things like our concentration, our ability to focus, our ability to feel confident, our ability to control our arousal. We get skills in mental health and working with people with mental health issues, drug use and addictive behaviour, what to do when we're working with people living with chronic conditions. You'll see in the second banner here about the counselling and communication skills, and these are so critical. They don't just set you up really well for jobs in this space, but they set you up for jobs just generally. And I think there was a couple of articles recently in some of the Australian major newspapers saying about how much people are looking at what they call soft skills, which are about communication skills, and how critical these are to employment and things. And this is what you're learning here, real hands-on things about how to communicate really effectively with people, how to facilitate behaviour change with people. These things really help not only, as I said, for these courses more generally, but set you up really nicely if you want to go on and do further training in OT, speech pathology, etc. Also, we have things on work and health, case management, and as Peter was saying before, we also have a field placement where you get that hands-on experience working in some of these spaces. And these are just some of the areas where people have done placement. We have relationships with places like the Carlton Football Club, Melbourne City, Melbourne Rebels, also things like Mind and working in community mental health and things like that. Yes, Hayder?
Thank you, Paul. I believe this is the end of your, yes, I believe that this is the end of your slides.
Thanks, Hayder. Look forward to talking to everyone when we get into the breakout rooms. Thank you, Hayder.
Thanks, Paul. So next we've got a set of professional course advisors available in Bendigo team to help you with your study if you are doing your course in Bendigo. So I'm delighted to introduce Associate Professor Evelyn Spelton. Hi, Evelyn.
Hi, Hayder. Hi, everybody. Nice to meet you.
So Evelyn is the discipline lead for health sciences over Bendigo campus, and also I've Dr. Karen Anderson, who's available in the meeting today. Hi, Karen.
Hi, Hayder. Hi, everybody.
So Karen is the course advisor for public health and health promotion in Bendigo. We've got also Dr. Joe Spock for rehabilitation counseling, Dr. Angela McLachlan for health, well-being, and performance, as well as Dr. Nicole Johnson as the course advisors for the honors programs. I'm not sure if I saw them in today's meeting. I think, yeah, they are in apology for today, but these are their contact details. Feel free to contact the relevant course advisors in Bendigo team if you are a Bendigo student. All right, after that, this is a couple of slides, generic slides relevant to your study at La Trobe University. You can access them from the La Trobe website. Simplest, just Google La Trobe calendar for 2021. You should be able to look on or access the PDF for these timelines. Most importantly, that semester one is starting in 1st of March. Make a note about the census date, which is 31st of March, this is the last day that you can withdraw from the subjects without penalty. And the semester one is expected to, or the results for semester one expected to be announced on 14th of July. If you access the full calendar, you will get all the information relevant to the whole year, including semester two, teaching period, like the winter, the summer teaching period as well. At La Trobe University, there are multiple resources that are available for you, and it's really essential for you to know or to be able to know how to access these resources. This including the Ask La Trobe admission team, learning management system, the LMS, La Trobe students' emails, as well as the library. I'm sure that the peer mentors presentation will provide you with more information about this, but this is just a quick run through the resources available at each one of these sections. So Ask La Trobe, when you contact them, they are able to help you with all the admin aspects related to your study, which include enrollment in the course, intermission, discontinuation, applying for course transfer, or anything related to the admin parts of your study is managed by Ask La Trobe team. The LMS is the official university platform that we use to deliver our subjects. Hopefully you all have able to access the LMS for your subjects for first year if you are doing. If you've got issue with that, please contact Ask La Trobe to help you with getting access to the LMS. So you will be able to access the subjects learning guides, lecture notes, and all the remaining resources for your subjects. Staff, university staff will only contact you via your official La Trobe email. And we ask you please only to use your La Trobe email when contacting us. And this is to maintain confidentiality. So we have been asked not to respond to a generic email because these are usually liable for or being hacked much more than the La Trobe University. So please use your official email when communicating with the university staff. And also we've got the resources available at the library. These are some of the information that you may be able to access from the library website, and I'm sure there will be a library training available for you in the first few weeks of the semester. Okay, so lastly, these are the 3 contact points for you. Make sure to contact the appropriate team for the your specific question. So Ask La Trobe, as we said, it's a one-stop shop for all admin or related components. Subject coordinators, you may need to contact the subject coordinators if you've got questions relevant to that particular subject, like the classes, like assessment, the timing of assessment, if you want feedback of the assessment results of your exams, and so on. If you've got questions related to your course as a whole, your degree, your majors, then you are able to contact either myself as a course coordinator or the right course advisors, depending on which major and which year you are doing. So lastly, these are like quick notes for you to take into consideration. Always be prepared for academic success by maintaining connection with all the academic teams in your area, with your colleagues as well. Make the most of the service available. We've got plenty of service available, not just the one that I showed you. So try to familiarize yourself with all the services available at La Trobe and make a note on which one might be useful for you at a specific period of time throughout your study. And ask for support. Don't be shy. We are always available here to provide help. If I'm not the right person to answer your question, I may know the right person to answer your question. So always feel free to contact us when you need help. Don't just say, okay, I will go through it, and you may miss an opportunity of help at that time.